Good morning, good afternoon, and good evening, everyone. Due to the time difference, it will be rather late for me in Singapore, so I recorded my presentation. Thank you, Chitra, for the invitation to speak at the 8th World Music Conference. I don't play musical instrument, but I grew up listening to my adopted father, who taught himself to play harmonica by listening. Music was his identity, his trusted companion, and connecting bridge with others. People only listened to him and saw his value through his music. Without his music, my father would be nobody because, in the eyes of others, he was nothing other than a psychiatric patient. That was when I saw the life changing power of music for vulnerable people like my father. Music can provide a sense of connection, support, and understanding during difficult moments when words alone might make it difficult for people to express and process emotion. Numerous studies have shown that classical music has the power to provide transformative relaxation at a subconscious level. For instance, a classical Chinese composition piece that I quite often listen to, like The Autumn Moon Over the Palm Lake by the late Lu Wenson, has a slow tempo and rhythmic consistency that can significantly shift one mental state toward calmness and positivity. Hence, incorporating music in my work with young children diagnosed with nonverbal autism come naturally for me. Like my father, music was a connecting bridge between me and my students. Through their tapping, I learned how to connect with them and mirror the tempo and the tone of their voice when they are tapping before I could work with them. It is from my work experience with these children that I saw the similarities between nonverbal autism and people with dementia who gradually lost their verbal communication abilities. Therefore, I believe more can be done with music intervention in supporting people living with dementia to improve their functional receptive communication skills, manage their anxiety or auditory sensitivity from external stimuli, and use music elements like tempo and tone in nonverbal communication. At the weekly online peer support group, La Copy, which I set up in 2021 during the COVID-19 pandemic in Singapore, we use song as conversation starters during the social greeting segment. It is an effective way for the members of different generations to know and appreciate the differences in music and the significance of music in their daily lives. For example, during the Japanese occupation, music was used to raise the morale and increase the nationalistic sentiments of young people. Though it was a difficult topic to talk about, but somehow the music helped to soften and make it less painful when older people relate their experiences during the Japanese occupation. It was an eye opener for me to see another life changing power of music. What else can music intervention do to support people living with dementia? Ever consider music prescribing to help those newly diagnosed with dementia with their anxiety? Anxiety is the first and the biggest issue that we experience. And the first line of anxiety treatment is the typical selective serotonin reuptake inhibitor prescription, called the SSRI for short. I was prescribed paroxetine to help me cope with my anxiety because I was easily overwhelmed. by crowded and noisy places initially. While the drug helped with my anxiety issue, it also made it difficult to feel my emotion, and I was not able to cry even when my stepbrother passed away, whom I was very close to. It was then I requested to be taken off processing after 3 years. Since then, I have learned to take preventive steps to avoid triggers and use calming music with rhythmical breathing to help me manage my anxiety. I feel in control of my life again instead of being dependent on the drug to manage my anxiety. That is liberation for me. I mentioned at the beginning how I use music to connect and communicate and facilitate expression with my nonverbal learners. Improvisation music therapy is hardly used with people who are gradually losing their verbal communication skills as dementia progresses into the late moderate to advanced stage. Family caregivers or those working in dementia care settings should be trained to hear, interpret, and respond to the music made by the person with dementia using simple instruments and body percussion like clapping, and some of them, people living with dementia towards the later stage would click their tongue or their voice. It should be seen as an alternative communications channel. For singing and listening to music is a beautiful and enjoyable activity. People with dementia need functional communication to stay independent and communicate their needs and wants. Dementia impairs a person's ability to communicate effectively. It reduces ability to decode and understand information, which is the receptive part of the language, and the ability to encode and therefore express information, that is the expressive part of the language. Many people living with dementia experience varying degrees of difficulty in following instructions, remembering where they stay, and so forth. Society seldom thinks of alternative ways to help them to maintain their functional communicative skills. We use familiar melodies to help preschoolers remember the step of washing hands or brushing their teeth. Why can't we do the same with people with dementia? In India, for example, MTV partnered with Alzheimer's and Related Disorder of India, ARC-D, to use custom created karaoke with 4-foot tapping sound to help people with Alzheimer remember the home address, names of their family members, meals that they had taken, etc. When people with dementia hum with the caregivers as the lyrics appear on the screen, like in karaoke, they are more likely to remember the information from the repetitive singing. This enjoyable and pleasurable way of retaining information can also trigger dopamine release, which is much needed in people with Alzheimer who can have different degrees of dopamine dysfunction during any stage of the condition. Dopamine plays a key role in learning, in attention, and improving the mood. Another major issue faced by people living with dementia is noise sensitivity. I carry earplugs with me all the time. However, I use them sparingly nowadays because excessive use would condition my brain to fixate on a quieter sound, which isn't always practical in daily life. Yet, unwanted noise in the environment can interfere with task performance, including having a conversation. Other than choosing a quiet time to visit a public space or stepping away from noisy areas, I have my headphones on to provide repetitive background music to help mask disturbing noise from the environment and help me relax and maintain my focus. Not all kinds of music, though, from that I discover through my experience. Only music containing higher repetitions of predictable patterns can help to reduce anxiety, thereby providing a calming effect. According to a study, when we listen to a track that we enjoy, the repetition of the beat and the bass line can create a sense of happiness, which can have a profound effect on our mood. This is because our brains are wired to respond to patterns and sequences, and the repetition of a beat can create a sense of predictability and familiarity that our brain finds pleasurable. I have created an instrumental music playlist that I will listen to during my daily commute or in social events to help me relax. Finally, I would like to call for your attention to a music intervention developed in Denmark to support those in the later stage of dementia in nonverbal communication. Person attuned musical interaction, or PAMI, PAMI, focuses on the role of communicative musicality in reciprocal contact between persons with advanced stage dementia and their professional caregivers. It is about using musical elements like tempo, tone, incorporated body language to connect and calm the person so they can be ready to do a basic ADL task like feeding themselves, taking a shower with less resistance. In conclusion, I hope you will go beyond the music therapy, the normal one, and be inspired to explore the many untapped life-changing opportunities that music intervention can offer to people with dementia. Thank you for your attention.
Caregivers and families in this vital role. So let's join in. Hello, everybody. How are you all today?
Hi, I'm okay, thank you.
Doing well, thank you very much.
It's a great pleasure to have you both at the 8th Annual World Music Conference and sharing your perspectives for the panel discussion today. Before we get started, could I please request you to introduce yourselves?
Sure, thank you, Chitraji. I'm Ramya, Dr. Ramya Mohan. I'm a consultant child and adolescent psychiatrist and also a performing musician with a special interest in the cognitive neuroscience of creativity. And much of my work has been geared around supporting those with mental health difficulties and emotional regulation issues, around using music and the creative arts to support optimal mental health.
Fantastic. Lovely to have you on board. Sunil,
Thank
would
you
you
very
like
much.
to introduce yourself?
Thank you, Chitra. Thank you for having me, and it's my great pleasure to be here with you all. I am Dr. Sunil Kumar. I'm an anesthetist in NHS, and I'm also board certified lifestyle medicine physician and health coach. And my interest particularly is in lifestyle medicine, where simple lifestyle changes can bring about the quality of health, improving the quality of health, which includes mental health as well as physical health.
And wonderful to have you on board and joining us in this discussion. Music therapy relies on the power of personalization to create meaningful and effective interventions for individuals with Alzheimer's. However, identifying the type of music that resonates with an individual can be a nuanced process, particularly given the diverse and unique experiences tied to personal and cultural preferences. How can caregivers or therapists systematically identify music that aligns with the emotional and cognitive needs of Alzheimer's patients? What roles do, if this has got a subsection, what roles do family members with various cultural backgrounds or the patient's life history play in this process? What specific strategies do you believe could effectively emphasize the significance of personal and cultural contexts in music therapy? Ramya, would you like to share your perspectives on this, please?
Sure. Yes, there's quite a few different strands to your question. So I suppose we could start with your very specific question around identifying the most personalizable or resonant music for those with Alzheimer's. And I think on that account, there are a few different things that I suppose one would need to consider. It's the familiarity of the music, because that has a direct connotation and connect to memory triggers, specific life events, or specific incidents in that in the sufferer's life, and that it can itself evoke emotional responses and positive memories, which would be quite key when one's trying to hold on to what is remaining. At the same time, having a specific focus on music from when the patient was a child, their childhood, their early years. A specific music can in itself stimulate memory recall, and this tends to be the music that's ingrained in childhood and adolescence tends to be the one that's quite deeply ingrained, really. And playing music from those formative years can in itself stimulate certain parts of the brain. Again, one key aspect I think we need to remember is that emotional states are quite important. Again, because in patients with Alzheimer's, they can be quite labile emotionally. Can be anxious one moment, aggressive the next, or sad another moment. And it's really important to bear that in mind when a specific kind of music intervention is being planned, and in some way supporting them to kind of recognize that process and recognizing that support system may have to be started again, perhaps after a period of time, is something worth considering. There's always going to be an element of trial and error when you're looking at personalized approaches, when you're experimenting with different genres of music or seeing what fits into that particular emotional context. So that's another thing I think worth bearing in mind. Could you just repeat the second part of your question? You had a specific question about caregivers.
I think caregivers also play a very important role in the sense, they need to continuously evaluate. Totally. You said rightly, the Alzheimer's patients, their cognitive ability, they could be sad, they have their own mood swings. The question was, what role do caregivers or therapists, how can they identify the music that aligns with the emotional and cognitive needs of Alzheimer patients?
And I think to a degree we covered it in what I was mentioning earlier when we're looking at things like memory recall or kind of sharpening cognitive functioning, particular familiarity, also taking into account long-term memory processes and all of that. Also, again, if we are in a way able to be structured, that can support with reduction of agitation or regression. When you're looking at specific routines that can be integrated into one's day-to-day life, that in itself has a component of familiarity, a component of consistency, and all of these are really important aspects when one is trying to get going with it. Again, it's the context, calming music, roundabout sleep, again, taking into account emotional state. And then when you're looking at physical activity, say you're trying to get them to become a bit more mobile, then I suppose using rhythm, using vibrancy in the music, all of those would be quite important. The other component, of course, is the caregiver, because that's a direct function to how the Alzheimer's sufferer themselves feels. It's such an important relationship. So that in itself, reduction of stress, both for the sufferer as well as for the caregiver, is a very important component that we need to consider. The emotional respite and how it has an impact on their stress levels. So just I think overall making sure that there's a predictable, comforting routine, as supporting the sufferer with accessing resources that work for them from their own knowledge of, because they would know, the caregiver would know the sufferer best. So from their own knowledge, and also kind of trying to understand them a bit better, understanding key or pivotal life experiences, how do you incorporate that into the nature of the music that's played. What does the background music have to be like? All of these would be, I think, really important in establishing a secure, safe environment, because for the patient with Alzheimer's, security and stability are paramount.
Absolutely, that's a fantastic response, Ramya. And if I may also please add one more element, from a musician perspective, I think it's important for the caregivers to also seek guidance from certified music therapists who can assess
Absolutely.
patients' needs and preference, and perhaps recommend specific strategies or musical selections. Would that also be a valid point here, Ramya?
Absolutely. Absolutely. And I don't think we can underestimate the importance of trained professional, because they, again, add to the standardization, consistency, and the stability that need to form a part of the whole caregiver environment. And in the same context, also working with groups, with fellow sufferers, with other age appropriate people, all of these I don't think we can underestimate the power of group activity, or even community engagement, because all of that can in itself support social engagement, social interaction, that in itself can stimulate the cognitive processes. So they're all kind of really closely intertwined. Absolutely.
Fantastic. Thank you, Ramya. We move on to Sunil. Sunil, would you like to share your perspectives?
I think I do completely agree what Ramya said. I think a lot of it is already covered by Ramya already, and probably you added some points already. But as a lifestyle medicine physician and a health coach, from my perspective, obviously lifestyle medicine specialty depends upon 6 different pillars, where healthy eating, physical activity, sound like optimizing the sleep hygiene, and then building social connections and keeping away from risk of abuse of other substances, and then finally stress management. So if you look at it, all these 6 pillars, the music can play a big role in probably having a higher impact in practice of these pillars for the patients.
Right.
And when coming to Alzheimer's, obviously for any mental health issues, there's a lot of evidence in lifestyle medicine which has shown and proven that by just optimizing your all these pillars of lifestyle medicine, you can still prevent, or you can probably stop the progression of any disease already they have, or even treat as well as a part of non-pharmacological therapy.
Right.
Still impactful as good as pharmacological therapy as well. So, for example, I would also look when you look at the history of these patients, when we ask, sometimes they do remember things, but if they don't remember, we can take from the caregiver or the family the history. Particularly coming to music, we can ask them what are this personal playlist they play at home or with the families, or what personal CD collections, or I mean, if they are quite old, obviously they will have cassettes or CD collections, or even the playlist in the app itself. And they would usually play some kind of music, some kind of genre at different moods of their life or at different events of their life. They would have played in the past. So use those things. For example, if they're quite playful and quite happy, they'll play certain kind of music. So if you use that kind of music when we want to build upon physical activity pillar of the lifestyle medicine, so then obviously if we play that music, even though they might not recollect themselves, but the music might actually make them do the things which they were doing before. So similarly in social connection, when they have got parties, social gathering of friends or families, they would probably like to dance or probably like to hear some certain kind of music which they've heard it in their own whole life. If you bring that kind of music to them when they're suffering from mental health or Alzheimer's or dementia for that matter, probably that will connect them, that social connection impact what it can have on the cognitive improvement, what Ramya was mentioning, probably that would help. Similarly, for sleeping, some people might be using some meditative music or some calming music, which they've been using all their life. Obviously, if that kind of music goes back to them at individual level, obviously that will help. These are my perspective from lifestyle medicine point of view. Obviously, most of it is already covered by Ramya anyhow, so it's overlapping.
That's fantastic, because as Ramya rightly said, all these are mostly interrelated, right?
Yes.
And we are addressing it together. So I'm sure our viewers also would benefit a lot, with this discussion. Now, moving on.
I think I'm particularly interested in exploring how music therapy can effectively be implemented in home settings. And so my questions probably will focus more on practical implementation and the crucial role of family dynamics and also the carer and patient dynamics as well in successful music therapy programs. So the first question usually, it is about emotional bonding, which can be connected through music. So research has consistently shown that music can create powerful connections emotionally, and it can access memories as well in the ways other therapies cannot sometimes. And could you share some examples like how you've seen the music can strengthen the bonds between the caregivers and Alzheimer's patients? And is there any moments which are particularly stood out to you, which can be used?
Yeah, no, sure. So with specific references to how the bonds or the emotional connectivity can happen, just going back to, it's interesting because I have a bit of a background in recreational therapy as well. And also, of course, from my training days in psychogeriatrics. What particularly stood out were those, communal moments. Whether it was the ward or the home setting, there were specific key moments. They could be meal times, there could be, people gathering around a specific TV program, and kind of laughing and chatting together. Those are the times when there is kind of a letting down of the guard, and the kind of the anxiety comes down, and the safety and security aspect kind of kicks in. So actually capitalizing on some of those times and having more of a free flow conversation where there isn't the necessarily, it's not necessarily instructional, I found has been really, really helpful. Then again, also, I think because we touched upon this earlier as well. The predictability is something I think that Alzheimer's patients do thrive on, particularly as they're finding that a lack of control is a big issue. So where they can hold on to control is where they know where they can anticipate what's coming next. So that there's that predictability component that comes in. So where within home settings, the surroundings were, predictable, neat, organized, usually they tended to thrive in such environments, and the interactions as well, because they do say, of course, have an uncluttered mind, and then you have an uncluttered mind when you have an uncluttered environment. So all of those aspects, I think I have seen that they really do come into play. The other aspect, of course, within the home setting is the support for the caregivers themselves, the extended ecosystem around the caregivers, which is so crucial and so important because, of course, they need respite and they need a break as well. And that's when they are able to function the way they should be. And we've seen certainly in families where there is good support systems where they come together when needed, both the sufferers and the caregivers thrive, and that's a win-win for everyone.
Yeah,
Absolutely.
That's a very good comprehensive answer on that. Yeah, and obviously, Chitra, you want to add anything there, or?
Yeah, certainly. Ramya, I understand. Music can be, customized, and they can be made as the family members can create personalized playlists. I feel sometimes, music therapy doesn't need to be overly structured or, to be more impactful. Just by weaving music into, everyday moments and being attuned to its effects, caregivers can create a consistent and sustainable routine that benefits both the patient as well as themselves, the caregivers. And you said another very important, valid point, which is the mental health of the caregivers themselves. That is extremely important. Only if they are in proper, what do you say, control, or in a proper alignment, they would be able to give their expertise or support to the Alzheimer patients.
We live in an information overload era, so it's also about sifting through what is available and helping them access the right kind of credible vetted resources when it comes to whether it's accessing, information or, community support, whatever the case. Yeah.
I do agree with what Chitra also mentioned about this. The burnout in the caregiver is quite common. So obviously you address that issue. It's we have to look after them as well. We always think about patient, but we never think about the caregivers. Either of you, have you observed any differences in the patient responses when family members or versus the professional caregivers lead the musical activities?
I think there's a certain kind of nurture element that comes into a non-professional caregiver, which is invaluable and it's got its own place. At the same time, when you're looking at a professional, they know how to temper things, they know how to moderate things, and they know when to kind of proceed and when to stop, which is again invaluable. I think they have to work in tandem, really. It's not one or the other. And in fact, there's a lot of work that happens between these two as well. So we've set up a platform called Cape for Health. It's called Creative Arts for Processing Emotions with a specific focus. It's a hybrid platform with access to music therapists as well as vetted resources, and it's personalized and adaptive. And we kind of use that as a support system in between sessions, with music therapists. At the same time, also kind of connecting the dots, as it were. So supporting kind of access to community event and group support, the online community, and all of that. So that's something we've endeavored to do through the app. For we've got a lot of research support for the child and adolescent population. Now we've expanded it out, and we have a module for the elderly as well. So I think, in terms of supporting them, I don't think it's about everyone coming together. It's collective effort. I think that's what I was trying to say. And this is work that happens all the time. It's not necessarily within a session or outside of. It's work that needs to keep going on day and day.
Yeah, there need to be a perfect balance, as Ramya said, between the caregivers and the family members, because sometimes family members could be much overwhelming, and but the caregivers, they know, they are professionally trained and they know where to start, where to stop, and how to deal with anxiety. I think there should be a fine balance between both of them, and in order to get the perfect result, the perfect outcome. Outcome need not be perfect, in the sense, in order to have a very
optimal, at least.
Yes, that's right. Yeah.
And it's a fine balance, isn't it? Because one of the key components we've observed in Alzheimer's, of course, is the loss of self-confidence and the loss of identity that happens over time. And that's something that can be debilitating both to the sufferer and to the caregivers and the family around. So each one's bringing in there's a whole gamut of emotions in each of them. And how do they play off against each other? It tends to be, in practice, quite a complicated relationship. Caregivers want to help, they want to take care, they're frustrated, they're dealing with their own emotions, particularly, family caregivers. And the Alzheimer's patient is just confused or angry or aggressive, and it just becomes a vicious cycle. So moderating all of that tends to be a dynamic process, isn't it? So it's something, unfortunately, no day is the same. Each day brings with it its own kind of
challenges.
a range of challenges. So it's about adapting to that, and knowing when to access professional help. And professional help is in clinical help, and working very closely with the clinician and the therapist to make sure everything goes well.
Perfect.
Thank you for those answers. I think I will pass it on to you, Chitra, for the next question.
Sure. Yeah. You've spoken a lot about, the Alzheimer's patients and the caregivers and the family members. Now, integrating music into the daily routine of the Alzheimer's patient is what we are trying to focus in this question now. Now, this has really shown to bring cognitive and emotional benefits, as we covered this in our earlier topics. From your perspective as a musician, Ramya, and as a neuropsychiatrist, could you share some specific examples or techniques that have proven effective in this process? Say, for example, how can music be used during activities like mealtime, relaxation, or exercise? What role do rhythm, melody, or personalized playlists play in creating a structured and comforting environment for patients? And additionally, how can these musical interventions be tailored to address the diverse needs of patients across different stages of the disease?
Yeah, so it's so complicated, isn't it? But at the root of it, I think we touched upon it earlier. It's very important to know what we call it the pre-morbid personality, which is basically prior to the disease onset. What was the person like? What were their likes and dislikes? So, getting to understand them as a person before the disease struck. It's a very depersonalizing disease, unfortunately. Would be, I think, quite key in establishing what works for them and what doesn't. And I think, as Sunil was mentioning earlier on, if it is someone who's quite lively, then soft music may come across as patronizing to them. So it's about taking into account, and it needs to be individualized in that sense. But at the same time, also bearing in mind that there is a lot of research that does go into the role of rhythm, the role of frequencies, and it's quite complicated. So having a broad understanding of that, I think, would be more for a clinician, more for a kind of somebody who's kind of trained to support in that area. But generally for caregivers and for families, I think knowing what their family member, the sufferer, was like, what their likes and dislikes were, would be key. But of course, taking again into account how that fits into routines, because we don't want a kind of really vibrant music around about, no death metal, around bedtime. I think is would be a fair statement. But then again, it is very difficult. It is very, very difficult to have one size fits all. And again, because it's a progressive condition, again, how can that be integrated into their activities of daily living? How does and the complete focus does need to be on their activities of daily living. What can they manage? What can't they manage? How can music be used to support that process in making them as independent and as capable as they can be, irrespective of the stage of the disease? I think is what perhaps would be really helpful for us to focus on. And ultimately it all boils down to the quality of life. It's about how comfortable they are, how able they are. So if we can bring all of those together, then music can do wonders.
Yes, that's so true. Yeah, you're right, because it is very important to know the history of every patient with Alzheimer's disease, and based on that, plan their routine activities would be more meaningful. As you said rightly, loud, jarring music would definitely be a put off or off-putting to some of them. Perhaps soft, uplifting music during morning routine or their mealtime activities would be ideal. Yeah, the relaxation technique also, as you mentioned before bedtime, loud music is certainly a no-go. And it would not help them to reduce agitation. In fact, it could be otherwise. So our intention is to provide them soft, uplifting music that promotes them to sleep better at night. There are various techniques, that we can follow. The caregivers can, set up a more structured routine for each and every, suiting to each and every patient, in their care homes.
Yeah, the next challenge is obviously to integrate it sustainably. I think that's the biggest challenge we face. And we frequently see that caregivers to maintain that sort of consistency with therapeutic interventions while managing other care responsibilities. So could you discuss some practical strategies here for integrating this therapy into daily caregiving routines without it becoming overwhelming either to the patient or even for the caregiver as well, for that matter? Obviously, I covered some points already before. So if there's anything, you can streamline it more.
There is an answer in your question, right? It's about how it can be integrated sustainably. It's again, I think we touched upon the predictability, consistency, structure, and those from my perspective, I think sum up the and the answers in your question.
Yeah,
Right.
maybe sometimes the barriers, if you find out any, pick up some barriers for implementation, probably if you address those barriers as well, probably help us. Yeah. Yes,
Absolutely.
Chitra, you want to add anything else, Chitra? Good.
Yeah, I mean, as a musician and working with, Alzheimer's patients, through South Indian music and dance. I believe we have again covered this in the earlier questions. It is important to set regular times for music sessions, where the caregivers can establish a daily or weekly schedule for music activities, such as, for the morning, they can start off with a morning melody and then soothing tunes in the evening to wind down. And then curate personalized playlists is what, again, we have touched base in the earlier question. Yeah, it's important also to make music accessible by keeping speakers or headphones or musical instruments readily available. For instance, caregivers could use smart devices because these days technology is advanced so much. We have a lot of apps such as Spotify to play music with voice commands, ensuring that the routine doesn't become very cumbersome.
Yeah, absolutely.
Slowly. The one big challenge we face is consistency with these interventions while managing other care responsibilities. Could you discuss practical strategies, please, for integrating this therapy into daily caregiving routines without it becoming overwhelming to the patient or to the caregiver as well?
I suppose the biggest aspect really in an unpredictable condition like dementia is making sure things are predictable and relatable and structured and consistent. So all of these aspects need to be covered, and that's best done in an organized, calm environment where there is where the sufferer knows what to expect. As much as possible, where there is an encouraging, empowering atmosphere that doesn't feel intimidating or challenging. So, all of these things do need to be taken into account, and it's best done by establishing not rigid, but good frameworks with through the day, so they're able to anticipate what comes next. That their challenges are staggered, and all of these, again, coming back to our conversation around music, all of these can be supported and encouraged with the use of music, whether it's about physically making them go that little bit extra with invigorating music, or whether help them ease into their nighttime routines with music that can calm the senses. So it's all about establishing a good kind of sensory equilibrium for the patient, especially when every day is so different and one doesn't quite know what to expect. Again, part of that would be, of course, making sure that there are good, professional support systems, whether it's kind of regular clinical appointments or sessions with music therapists, and in between all of those, how the patient can be encouraged to kind of manage themselves again by regulating themselves through the use of music. So it's about integrating all of those aspects into daily living.
Sure. And I feel as a musician, I believe that ensuring consistency and sustainability in incorporating music therapy into caregiving routines involves both structure and creativity. As Ramya mentioned earlier, it's important to set regular times for music sessions and then curate personalized playlists and also make the process simplified. And it's important to engage the patient, encourage the patient to sing along, clap, or hum if they want to or if they can, and simple rhythmic activities to make music therapy more interactive and more enjoyable. And evaluation, as we mentioned in the earlier topics, is also important. How the Alzheimer's patients, how have they progressed, and how has the patient's response to music been since they started over time. So I think these are equally, these are important to make it more sustainable and incorporating music therapy into caregiving routines.
Yeah, that's quite comprehensive. Thank you. Do you have any suggestion for some caregivers who are themselves not very inclined towards music? I mean, have you seen those kind of, is it the role of music therapist come much more stronger in those kind of caregiving? situations? I don't know.
I think I have, with my little experience of working in care homes, particularly with senior residents with dementia and Alzheimer's, I have come across such instances. And I think primarily it is important to, speak to the caregiver and to the carer and explain what this could actually do. And it is sometimes I've had times where it is very difficult to convince, particularly if they are totally not inclined towards music or they don't believe in this. So I think you have to give them some time, and you have to make sure that when you work with the patients, it is important that they are present and they can monitor their progress over time and see how the patient has benefited. I mean, this is one of the things that I have found during my work with the caregivers and the care homes.
Yeah,
That's insightful.
that's
Yeah.
really valid. Just to add to that, another thing that I have seen really is that sometimes when caregivers are resistant to the concept of using music or music therapy generally, that may well be a function of their own stress, because which they may not be very insightful about. It may involve an educative kind of process wherein it's about helping them understand their own stresses and how they are playing out, and again, coming back to what we were discussing earlier, this is a very important barrier to kind of patient recovery or patient support. So working with that aspect as well, and also kind of separating the two really, in terms of if it is not something that they do believe in, what was the patient like, and is that something that they would have believed in, and how can that be then encouraged without, as part of caregiving responsibilities? So it would be another aspect, I think, to think about.
That's nice.
Yeah, and also,
Thank you so much for that. Yeah, I think we'll pass it on to Chet. Next question.
Yeah, one other point I would like to add here
Sorry, yeah.
to what Ramya has explained. Involve the caregiver's preferences. Sometimes what happens is once you start playing their own preferred choice of music or any particular song, it's important that music is for everybody. Nevertheless, there are people who are not very much inclined to music. In such cases, we speak to them, and then perhaps there could be some kind of music which they have heard or listened to in their childhood or during their current time as an adult. So it's important that we give preference to the caregiver also to avoid the burnout. They can include music that they enjoy. And the shared music experience can certainly foster a connection between the caregiver and the patient, making the routine more sustainable.
Yeah. I mean, obviously, I agree with you both. I think Ramya has rightly said this. Maybe they might not be inclined for their own emotional status, or I'm talking about caregivers here. They could be stressed themselves, or they might be going through their own crisis.
Yeah.
Anything can happen, whether it be the burnout or anything. So obviously, once we address that, and then once we say that this is evidence-based, the best therapy for the patient, and again, as a part of education again, so obviously they might come back and say, okay, please do try.
Sure, yeah. Can you share specific examples or techniques of integrating music into a daily routine for Alzheimer's patients? For instance, how music can be used during activities like mealtime, relaxation, or exercise. What role do rhythm, melody, or personalized playlists play in creating a structured and comforting environment for the Alzheimer's patients? And additionally, how can these musical interventions be tailored to address the diverse needs of patients across different stages of the disease?
So just to address the first aspect of your question around how it can work around routines, there's two components, I suppose, that come immediately to mind. One is the nature of the activity itself, the nature of the routine, whether it's as you said, meal time or sleep time or physical activity, that in itself would give us an indication of the nature of the music, whether it's calming or whether it's vibrant or kind of lively. But at the same time, also to take into account the emotional state of the person and make sure that there isn't a dissonance there. So I suppose the important thing is to, so for example, if you have a sufferer who's feeling particularly angry and agitated, but they're due for their physio, I suppose it'd be quite tricky to kind of put quite lively kind of empowering music, because it may well increase the agitation. So I think it's really important to take a very considered and sensitive approach to identifying the nature of the identifying the emotional state of the patient, at the same time considering how it could fit into routine. So that takes a bit of understanding and sensitivity for sure. But broadly speaking, yes, there are lots of studies to show the impact of rhythm and frequency and the nature of the melody on the emotional state and the areas of the brain that correspond to that. So I think very broadly speaking, generally speaking, calmer music for some of the more calmer, kind of more conducive activities like mealtime or sleep, and empowering music. I think that's a broad guideline, but we do have to obviously take into account a lot of other factors before determining that. So it's not usually a one size fits all. That's the hardest bit about Alzheimer's, I think, is that we don't know what each day brings. So it's about the caregiver being educated and sensitive to what is required at that point in time. But yeah, I think certainly there are definitely some of these guidelines that we can follow. The second part of your question was about, I'm sorry, could you repeat the second part of your question?
How can these musical interventions be tailored to address the diverse needs of patients across different stages of the disease? Say, for example, yeah, in a care home, there are about 50 individuals with Alzheimer's.
Yeah.
And each one, perhaps, or a group of them will be different. Their intensity might vary, right? How important, how can these be tailored to address
into account? Absolutely. So the hardest bit about dementia and the complexity of the illness, unfortunately, is that one doesn't know what an advanced stage brings. In some, it brings aggression. In some, it brings withdrawal. In some, it brings depression. In some, it brings anxiety. In some, it brings a mixture of all of these things. Again, coming back to my original point about being aware of where the patient is at emotionally, physically, in terms of their independence, their self-esteem, their identity, their support systems. There's a lot of factors that need to be taken into account when we're working with dementia. Also, not forgetting the very important aspect of age and physical illness and all of those comorbidities as well. So if we have to take all of that into account, I think a broad guideline would not be very much the stage of the disease. It would be very much the emotional health and the mental health of the sufferer, their own personality in terms of their need for independence or not, their compliance with treatment, and their engagement with the activities that are provided. All of these need to be considered. So again, there's not one size that fits all.
True, yeah, because when you have diverse needs with different intensity of the disease, it's important to address them in a very structured way and suiting to each and every individual, I suppose, or a group of people. Yes, in addition to that, the age and other physical health issues also play a very important part. Sunil, do you have anything to add to this?
I think, yeah, Ramya has actually covered comprehensively everything. Again, if you look at from lifestyle medicine perspective, obviously for each pillar to build up, music gives an extra for an extra impact to do them more. If even for social isolation in the ward or anywhere else, if there's a music which can bring everybody together, each few patients or few carers together, even that is more impactful as well. It has shown, evidence has shown that it enhances social isolation problem, not problem, solution to the problem.
Yeah.
And the second part of the thing is like a lot of cultural problems. Like if there's a patients who are non-British or non-white, obviously going to these kind of setup, these nursing homes here, the music therapy, which the kind of genre, the music therapy which they prescribe or which they try to encourage might not help because some of our Asian patients might want to hear the religious hymns. Could be Muslim want to hear some Muslim hymns, or maybe Hindu people want to hear some our Hindu type of chanting and other things. So if you take that into consideration as well, probably that might be more impactful than going a tailor-made like a blanket therapy, blanket music therapy. Obviously, as Ramya mentioned, it is no one size fits all. It has to be individualized, and even individualized should be to their own personal individuality as well as their personal culture and religion as well. So obviously that will have more impact, I feel. So
Culture also influences to a very great extent, and one size does not fit all. So,
and second thing is again the calming music, even the prayers or anything what some people might be used to it before pre-morbid state, like if they're used to chanting prayer or something before going to sleep, that might be maintaining their circadian rhythm and sleep rhythm for years together before. So if you don't give that music back to them for sleep, to optimizing the circadian rhythm for their sleep when they're actually mentally unhealthy, it might not have impact. Any other music might not have impact for them, I feel. I don't know. So
yeah, because they are attuned to listening to that kind of music. So
exactly. So
makes sense. Yeah.
yeah. Next question is about extended family involvement. We know that there's a family carer who is a next of care, somebody who's looking after the patients, but this is more about the extended family. So, what specific roles or activities do you recommend for family members who don't serve as a primary caregivers, but obviously want to contribute meaningfully to the music therapy efforts?
So the role of the extended family again would be really crucial, really, in terms of supporting the caregiver as well as the sufferer and ensuring sustainability of any interventions that are implemented. And from that perspective, bringing their own natural kind of empowering vibe into the whole equation would be, I say, would be quite a helpful, positive thing. At the same time, they might be able to help out with more practical aspects. The younger ones might be more tech savvy, so they might be able to help the older patient, with the elderly, with things that they're not particularly kind of accustomed to, whether it's kind of helping them with accessing music of their choice, or whether it's about a particular artist, say the Beatles or something that they'd like to kind of listen to it at any point. And again, as earlier as Chitra was mentioning, potentially kind of supporting access to all of this, supporting access to music in every form, whether it is through the use of through online media, or through kind of easy access to being able to create music or having musical instruments and all of that. Another very important aspect is about, again, using technology to support with developing those playlists, and encouraging, also kind of supporting carer and sufferer stress through kind of an independent kind of, well, not particularly independent, but a more kind of a neutral approach to what might be helpful at that point. Again, trying to balance caregiver as well as sufferer's expectations, so they may be able to potentially play a role in that aspect as well. So I think in terms of kind of being part of the ecosystem, ensuring that some of the routines that have been set up, particularly with relevance to music, are implemented, particularly at times of crises or heightened stress, would be another role.
Also, I feel that family members can, also offer respite for the primary caregivers after a very
Yeah, I was about to tell the
tedious
same thing. Yeah.
day. I mean, they can perhaps give some kind of respite, for a few hours so that they can
Yeah.
recharge and come back and do what they're supposed to deliver.
Yeah, that's very important point which you mentioned, Chitra. I think it's a lot of the times they do try to neglect their own health, caregivers, without their knowledge sometimes, and subconsciously they are mounting towards from stress towards burnout stages.
Mm.
So obviously, some family member who extended family member who is happy to help them, if they can give a respite or just a break for a day or for a few hours, as you said, it's
Yeah.
a great thing.
Perhaps even giving them a patient ear if they have to pour out their frustrations, that goes a long way as well.
It goes long way,
Mm.
definitely. Yeah.
If the caregiver is not in a good mood, or
Inclined, not
if they are
inclined to
not
the
inclined
music.
towards music, what best can be done to help them? That's a very valid question. Are there any online courses or certifications that provide
Resources.
practical guidance, to the caregivers? And
Mhm.
additionally, what role can healthcare institutions, music therapists, or community organizations play in equipping caregivers with the necessary skills and knowledge?
Looking at specific situations, again, from my experience, where caregivers have not always been very amenable to the idea of music therapy, it does help kind of take a bit of time to try and understand where that's coming from.
Mm.
Tends to stem from a place of a stress or frustration, which is being played out because that in itself is overwhelming, and they're not in the headspace for anything more musical. Not necessarily that they're kind of opposed to it. So that's definitely worth bearing in mind. So taking some time to also educate them around the helpfulness of music for patients with dementia, and helping them kind of understand and separate out their own needs and caregiver responsibilities from the needs of the patient would be again quite helpful. And helping them access additional support systems for themselves can in itself go a long way. So that's to answer the first part of your question.
Mm-hmm.
In terms of what resources are available, I'd say certainly in the UK, there is a lot of emphasis on the voluntary sector to be able to provide some of the supportive interventions. And certainly from my kind of 20 odd years in psychiatry, I have seen a shift in. I've certainly worked with more music therapists about 15, 20 years ago than I do now. And that is to do with the way the healthcare system has progressed towards more of a crisis intervention and firefighting model, as opposed to kind of taking a more balanced and reflective approach, because there isn't the luxury of that anymore, given the need of the pressures mental health care of the mental health care system, particularly post COVID. So I think there is a lot of emphasis on the voluntary sector to bridge that gap, which I think there are certainly societies like the Alzheimer Society, or they certainly can support in some of those aspects. From a music therapy perspective, certainly in the UK, the Association of Music Therapists, that's a good resource for access to validated, vetted, licensed music therapists who can support. Again, I think it's important to bear in mind our earlier conversation about kind of cross-cultural the role of kind of cross-cultural factors and the socio-demographic factors one needs to consider when we're looking at engagement with some of these things. So all of those things need to be considered. And it is possible, I think. There are certainly more kind of ethnic aware organizations as well working in that context. Again, similarly, yeah, they have similar ones in America as well. So they offer these support and training programs. There is a lot, of course, online. The difficulty is about separating the wheat from the chaff and figuring out which is useful, because the important thing is that even if it doesn't help, it shouldn't do harm. I think that needs to be our so we need to make sure that what is being accessed is kind of credible and appropriate, I think, and that's a really important thing. Certainly, I think that is something that we've tried to address in our in Cape for Health, which is a mental health platform where we have established a module specifically for the elderly, where we based it on scientifically validated studies in other focused populations. We've extrapolated those findings, and we're in the process of making it more scientifically robust in that sense. So it does, and of course there are other aspects, so within the platform, what we've tried to do is provide access to therapists, and also have kind of components that the sufferer and the caregiver can work. We actually have a component for families as well. So it's to address various aspects, and alongside that, over the years, we have done multiple community engagement events in terms of supporting people, because it's about educating the community, creating more awareness. And again, it all goes towards building a sustainable, societal ecosystem, doesn't it? So it's about kind of also looking out for some of those local events in your community that one can access for support. Again, group support, which could be family group support, or perhaps fellow sufferers. Again, voluntary sector is a good resource bank there. And also online communities. And we've actually done something similar in other populations, in child and adolescent populations, for example, which can be easily extrapolated. The important thing is that there needs to be these online communities are, again, managed and moderated in an appropriate manner, because they can easily get out of hand. So there's lots of factors to consider, but certainly I think if one looks hard enough, there are lots of resources that one can actually access.
In terms of therapy association, accredited associations such as the American Music Therapy Association and the British Music Therapy Association, we do have a lot of volunteer groups. The local groups and associations organize webinars and virtual events where the experts discuss about music therapy and share their expertise. But I also feel that it is important for the caregivers to come forward and also share their experience on maybe a public platform or within their local groups, so that the other caregivers might also find that very helpful in their day-to-day activities with the Alzheimer's patients.
There's one other resource, of course, and that's social services, and they tend to come in where there are, of course, concerns around vulnerable adults or safeguarding issues. I think it's important to highlight, and they are a good resource as well. They're a good way of kind of being able to signpost and streamline resources that caregivers might require.
And also this, as Chitra already mentioned, I think the ex-caregivers can probably give their own blog stories or their own social media platforms. They can share what they can do. Especially, it's very important in culturally appropriate communities, because if somebody Asian has already gone through this, if any other new Asian caregiver is coming into picture, obviously he will be the better person to tell and explain to them all the nuances of culture and also the music, the way they've been looked after. And something similar happens in our sector. Like I'm being an anesthetist, I do get involved in rehabilitation, where we teach patients who are waiting for elective surgery to be physically fit and mentally prepared for the surgery, just like preparing yourself for a marathon. And that has good outcomes. That has good surgical outcomes post-operatively, and they get discharged home quickly as well. So, and the patients who finish all the journey post-operatively, and once they become better, they become patient champions to the next patients. And so the alignment of information is much more impactful there, because it is going from one same person journey to the next person on the similar journey as well. So even though they attend all webinars and seminars and books and everything, but still the impact is much more better when it goes from somebody like that. So that's what, I think we got 5
but again,
minutes.
that is also culturally bound, right?
Yeah.
So that the cultural influence is very important there, and it differs from different cultures also. Yeah, with different cultures.
Yeah.
Mm.
And the language barrier also helps there sometimes. So
Absolutely.
So I think we have done a very
record it.
coverage of the important aspects of how music can be a very integral part. I know it doesn't involve very much in the prevention, but at least such non-invasive approach, I feel, such as music, can have a great impact. Particularly with people with Alzheimer's and dementia. I want to thank you both for your valuable time and sharing
Thank
your
you.
expert
Thank
views
you
on
so
this
much.
topic. And I'm sure our audience, which is quite varied, would also have some positive takeaways from this discussion. I look forward to seeing you all at the 8th Annual Virtual World Music Conference, which is scheduled for the 7th of December. I really appreciate your time and your support. Thank you so much.
Thank you.
Take
Thank you so
care.
much.
Thank
Thank you,
you.
Ramya. Thank you,
Bye.
Chitra. Thank you.
Hello, everyone, and welcome to the 8th World Music Conference that is held on the 7th December 2024 this year. I'm extremely thrilled to announce that I'm going to be talking about the future of music interventions in neurological disease, innovative research, and the potential of music in Alzheimer's prevention and management. And what is the amount of research that has been done in this area, and how these technological advances help alleviate the neurological disease and music interventions? How do they help in understanding Alzheimer's disease and Alzheimer's related disease, for example, one of them being dementia? And so, to kick off this discussion, I am very fascinated by a paper that was published in 2023 by Dr. Edwards. And their lab did an extensive research, and they published a paper that encompasses all the music based interventions for brain disorders of aging, including Alzheimer's and Alzheimer's related diseases. And the title of this paper is basically National Institute of Health Music Based Intervention Toolkit. So, a bunch of researchers put together this toolkit, and they discuss what are the ways to go about assessing neurodegenerative diseases. Now, the essence of this paper is basically music based interventions show promise for managing symptoms of various brain disorders. And in order to understand the significance of these music based interventions and to remove the outdated misconceptions that are associated with MBIs, that all these interventions and assessments are rooted in soft science and not empirical evidence, the NIH is promoting rigorously designed, well powered music based intervention clinical trials. And these clinical trials have significant guidelines for scientifically rigorous studies with enhanced data collection brought together the different kinds of foundations that the NIH put together. For example, the Renee Fleming Foundation, the Foundation for the NIH, the Trans NIH Music and Health Working Group, and an interdisciplinary scientific expert panel to create the NIH Music Based Intervention Toolkit for research on music and health across lifespan. So the toolkit is very interesting. And in order to dive deep into this particular toolkit, it's important to understand that it defines the building blocks of the music-based interventions, including a consolidated set of common data sets or data points or elements that are required for these protocols, and the core data sets of outcome measures and biomarkers for brain disorders of aging that researchers may select in order to conduct their studies. Now, utilization of the guiding principles in this toolkit is strongly recommended by NIH and NIH funded studies for music based interventions. So I'm specifically intrigued because this year's conference pivots around Alzheimer's and dementia. And so, music based intervention is one of the interventions that is currently being carried out globally as we speak. And because the number of projections of aging population by 2050 is going to be staggering. And so it's important for clinicians to understand when they are putting up programs or research funded groups together, what kind of assessment, clinical assessments that they can do in order to define the biomarkers. Now, one thing to remember is that there have been significant studies over the past. You have the rhythmic auditory stimulation, a neurological music therapy that involves the presentation of auditory rhythmic cues. That has shown a great promise for the treatment of gait disorders in individual living with PD, for example, Parkinson's disease. But there also have been some amount of misinformation in terms of system management and brain disorders of aging, large scale, rigorous, well designed studies that are needed to fully understand how music affects the brain and its therapeutic potential for these conditions. So there are multiple challenges that clinicians come across, and one of the major limitation to widespread application of music-based interventions has been the scarcity of data, because we need rigorous data and we need well powered studies. And reports of the beneficial effects of music based intervention have emerged either from anecdotal evidence or small scale clinical trials. So, in order to understand in depth, it's important to understand how music affects the benefit or benefits the quality of life for people living with dementia, for example. Now, the study put together to illustrate this point, an Agency for Healthcare Research and Quality and the National Academies of Sciences, Engineering and Medicine conducted a literature review in 2017 to assess the data to understand the science regarding non-morphologic approaches, including music that might benefit the quality of life. So this report was released in 2020, and they studied about 35 case studies, and they found evidence was insufficient to draw conclusions about the benefit of music therapy for agitation, anxiety, depression, mood, and quality of life for people living with dementia. So there are certain limitations. Another challenge that you can also encounter is the broad implementation of music-based interventions with lack of consistency and descriptive terminology. A set of scientists may end up using a set of terminology that may not exactly reference another set of terminology used by another set of researchers. So music-based interventions are divided into two major categories. One is music therapy, and the second is going to be music medicine. So music therapy is an established health profession, as we all are completely aware of, in which music or pieces of music is used within a therapeutic relationship to address physical, emotional, cognitive, and social needs of individuals, and includes the triad of music, clients, and qualified credentialed music therapists. So these are the three major requirements. Now, by contrast, music medicine is defined as having patients just sit in their caregiver's office or in the clinic and listen to pre-recorded or live music, which is often managed by a medical professional other than a music therapist, such as the music plays the role of a medicine, so to speak. So music therapy and music medicine does not require a therapeutic relationship with the patient. A clear distinction between the two types of music-based interventions is very crucial for assessing treatment response and functional outcomes. So how can we harness this therapeutic potential of music-based intervention? And so NIH developed a music-based intervention toolkit that outlined the methodology and the approach. And so they addressed key objectives, so to speak, and the aim of this toolkit was one, to address the fact to provide music and health researchers with a music-based intervention toolkit of recommendations in alignment with the NIH policy on rigor and reproducibility. That is key for any method to be developed, to be validated, and to be assessed. This is one of the key requirements, as we know. Second is to delineate the building blocks of music-based interventions. Third, to define a core set of common data elements for music-based interventions, protocols in various domains, for example, as I mentioned, cognition, emotion, motor function, and sensory function. To identify a core set of functional outcome measures and biomarkers focused on brain disorders of aging as a model system for music-based intervention research is another objective. The next objective was to provide a framework and foundation for future music-based intervention research that can be applied across the lifespan for various disease conditions. So what was something specifically developed for neurological disorders can also be applied for other deteriorating indications. So the last objective was to create guidelines for intervention, research on music, and health. Now, all this sounds very exciting. It sounds very promising, but it is a Herculean task to put together such a toolkit. And they successfully, in fact, created essential components of such a toolkit, and they conceptualized this toolkit to promote incorporation of music-based intervention studies with the following elements. So they said, in order to start a clinical trial for patients with Alzheimer's or Alzheimer's related disease like dementia, a researcher or a clinician should have a conceptual model or framework to guide the design of the intervention, a clear research question, and the provision of supporting data to test the posited hypotheses, of course. The third is a core set of common data elements or building blocks that must be included in every music-based intervention across the globe. A comprehensive description of the intervention, a detailed protocol for delivering the intervention, the population to be studied needs to be defined. And lastly, the control groups or the comparators. This is very critical. Otherwise, all the data, the empirical data sets that have been collected will not make any sense without comparing them with different populations or different age groups, so to speak. So it's important to understand when you make a conceptual model or a framework proposed intervention, you need to have an evidence-based medicine model. Population, intervention, comparison, outcome, and study design are the main components of such a model. The next is you need a study design that is static or mixed models or adaptive. The certain examples of models or frameworks would be behavioral versus experimental medicine, music therapy, neural and resilience, or social science that can be used as a research. So experimental medicine framework involves different guidelines. For example, you can have the NIH has what is known as the NIH Science of Behavior and Change program. Has a theoretical model that highlights the components of music that are likely to influence the potential processes or mechanisms that in the context of a specific study result in changes in the outcome of interest. So certain examples, mechanisms would be cognitive, emotional, and physiologic. And the outcome of interest would be cognitive, emotional, and functional outcomes. So music therapy definitely does need a framework. You cannot just pick a piece of music and just expose the patient or to subject to such a kind of music. So it needs a framework for music therapists, including clinical settings, client population, what is the age of the client, diagnosis, and theoretical orientations of the therapists. So music therapists use a combination of various types of frameworks to address the client's needs, for example, including dynamic, humanistic, behavioral, and music-centered approaches. So just to give you a brief example, the researchers do quote an example of humanistic approach to facilitate respect, trust, engagement with their clients, and further incorporate a behavioral approach that uses music to redirect the focus of attention to obtain a desired response. That's pretty amazing. And an important consideration for determining which approaches are most appropriate is ensuring all the client's needs will be addressed by chosen combination. The other example is neuromechanistic framework. This framework requires interventional studies that provide a mechanistic conceptual grounding that builds connections between clinical and basic research. And the last thing that I mentioned was resilience framework. As the name suggests, it uses a contextual support model of music therapy that is based on motivational theory of coping mechanisms. So music engagement is then used to reduce stressful conditions or mitigate risk situations. So once you have a hypothesis, you have a framework, you have a hypothesis, the next thing is, what are the building blocks and common data elements? All these frameworks have to be measured with a clinical outcome in order to know that there are physiological and underlying neural responses to music. So our brain functions in a very interesting manner when we hear to music. There is subtle physiological changes that bring out hormonal changes that increase or decrease the dopamine levels, so to speak, as we all are aware. But scientifically, enough research has been done, and Nature Reviews of Neuroscience has produced a very in-depth, comprehensive article that had come out of Dr. Brain's lab, and it's very interesting if you can have the time to read it up. But they said they put together a model that shows how you can measure music based intervention outcomes. Is music treatment approaches like music therapy and music medicine have mechanistic and clinical outcomes, and finally these clinical outcomes are measured by biomarkers. And how does this work? It's a very integrated network of measurements and outcomes. And so one, you have cognitive, emotional, sensory, motor, behavior, and psychological outcomes, measurements that you can do. So how can you do cognitive measurements is through the auditory motor pathway. Next, emotional will also can be measured by auditory limbic pathway. The somatic motor system measures the sensory pathway. The visceral motor autonomic system measures the motor pathway. And the acoustically activated vestibular pathway, of course, gets measured very easily by all the different cognitive, emotional, sensor, motor, behavioral, and psychological changes. And so this system, once you have framework, a hypothesis, you know what biomarkers you're going to assess. And the next step is how you're going to deliver this protocol. So I'm talking about interventions. It's important to understand what is the underlying framework for these interventions. And so we are basically going through over these interventions. Now, how do you define intervention? Interventions for different indications have different definitions, medically speaking. But in case of music therapy or in case of music medicine, define intervention. When we define intervention, the NIH strongly encourages that investigators should consider specific elements of music, for example, the pitch, the timbre, or the rhythm, modes of engagement, such as actively performing and creating music or passively listening to music, the relationship between culturally specific music preferences and outcomes, patient demographics, and contextual factors. These are the things one should keep in mind. So, and the next step is, of course, protocol delivery. How do you do this protocol delivery? Now, critical considerations have been done about the delivery by different research groups. And in this particular toolkit, it is a sum and substance of all the different types of delivery. And so for music-based intervention studies, they suggest one is music characteristics, example, live versus recorded, music genre, personalized versus non-personalized, and patient-selected versus investigator-selected. The second thing to keep in mind with the protocol delivery is research setting. Do you have it in a laboratory, or you have it in a clinic, or you go out to a free community clinic and you do it in the community? The third aspect is the mode of participation. Is it a group participation or an individual is participating, or is it in-person versus remote delivery? Fourth is the time scale. Short-term, define time scale, long-term, how session length and intensity, follow-up frequency, or potential for habituation. The fifth is staffing and support, which is very critical for protocol delivery. Expert therapists versus wide range of providers with appropriate training. Sixth factor is resources and organization. What is the cost, what is the scheduling, and what is the assessments? All these three factors need to be taken into consideration. And lastly, of course, what is the feasibility of the protocol? What is the accessibility of the protocol? And how best the QA and QC has been on this protocol with respect to adherence? These considerations are very important to objectively establish the intensity of the intervention needed to observe clinical improvements and maximize dissemination and implementation of the interventions. So once you have the n number of study populations, you have defined control groups, you have defined comparators, and then you come to the last step of the protocol in an intervention is potential outcomes that measure the biomarkers, examples for brain and brain disorders of aging, MBIs, AD, Alzheimer's disease, for example. What are the mechanistic and clinical outcomes? One needs to know that these measurements are needed. So in order to choose a conceptual framework for these outcomes to be measured. Choosing the appropriate study design is the key. Once you have a protocol, you need a study design. So, identifying relevant domains for proximal and distal outcomes, for example, short term and long term, what are the boundary conditions, example, moderators, and mechanisms or mediators, and determining the relevant biomarkers. For each domain, a range of measurement is necessary. Measurement modalities need to be defined, if possible, including self-reporting, performance-based measures, direct observation, or sensor technology measures, physiological monitoring, and various functional brain measures, each of which has strengths and weaknesses for assessing the domain of interest. Therefore, multimodal assessment of a given domain is often preferable in this toolkit. Now, we all know what is the definition of biomarkers as a clinician, but in layman's terms, it is defined as the characteristic that is objectively measured and evaluated as an indicator of normal biological processes, a pathogenic process, a pharmacological response to a therapeutic intervention. So, biomarkers can be used to parse out the causally active components of an intervention and provide insights not just into whether an intervention works, but also how it works. And that is the key in Alzheimer's disease and dementia for early detection awareness. Biomarkers can indicate susceptibility or risk. They can predict or measure a condition or response, assess safety, or be used for diagnosis and prognosis and monitoring. So there are different kinds of guiding principles that can help practical implementation, considerations in choosing mechanistic and clinical outcome measures, and identifying biomarkers for music-based interventions. So you have different kinds of outcomes. You can have patient-reported outcomes, mixed method design, and participatory methods to address context, race, culture, and geography. The stage of the disease and disease outcomes is a critical factor. Investigators must identify the specific domains, motor, sensory, emotional, and cognitive domains. Measure the psychometric properties. For example, they should thoroughly address subject burden and the number of outcome measures in their study design. The risk-benefit ratio of music-based intervention must be seriously considered without fail. Potential risks include exacerbation of symptoms, for example, anxiety produced by exposure, expectations of skill learning, falls and failures, for example. So these are the kinds of considerations to be taken into consideration. Now, let's see, in order to understand the technological advances of music-based interventions, it is important to understand how these domains are measured, how these potential outcomes are measured that are quantified for music-based interventions. Let's start with the domain of emotion. One of the decline is emotional well-being for Alzheimer's disease and dementia patients. So you would measure anxiety, depression, emotional regulation, affect, awe, joy, happiness, motivation, and interest in life. Most of the patients lose interest in life because they have a declining memory and they don't remember their own surroundings, community, or family members. So they don't have a sense of belonging, so they don't have an interest in life. The second domain is cognition. Cognition is language therapy, try to speak multiple languages, alertness, short-term memory, long-term memory, biographical memory, and motivation. The next factor is motor evaluation, mobility, your physical mobility, how often the patient trips and is not steady and falls, or gauge speed. The next factor is sensory, how the autonomic function of pain and hearing and noise is measured, should be documented. Interoceptive awareness and accuracy should be measured. Next is behavioral domain, where aggressiveness, wandering, agitation, psychosis, apathy, and impact of medication is measured. Social domain, what is the social connection? How often does the patient come out and interact with his own community members or his family members? How, if is he aloof or he has a social belonging, and altruistic measures. Engagement behaviors like self-efficacy, responsiveness to music, flow, creativity, and artistic identity is critical. The next domain is functional status. whether the patient is able to do his daily, day-to-day activities, what is the quality of life, the level of independence, the well-being, and the sleep quality. The next domain is voice or speech. What is the voice quality, control, volume, and level of voice output? And the last is, of course, the caregivers, where most of the Alzheimer's patients and dementia patients end up with. What is the burden and emotional impact? Now, there are different policies and different recommendations based upon country to country globally. And so, in order to make a rigorous music based research, intervention research toolkit, it also requires a team science approach, bringing together different groups of varied expertise, perspectives, and ideas. And to be successful, the investigative team should be interdisciplinary and have expertise in population or health conditions of interest, intervention, development, target outcomes, neuroscience, primarily and relevant biomarkers. So it takes a lot in order to develop a technology for music-based intervention toolkit. It's important. So we have thus far seen what is a toolkit, how a toolkit is defined, how a toolkit is put together, what are the integral elements of a toolkit, how this toolkit converts into a framework, then a study design to a protocol, then a study design, and what are the outcomes of the biomarkers that are measured. So once you have a toolkit, you can use utility of various technological advances in behavioral measurement that enable the rigorous and robust measurement of data. Now, among these advances are the item response theory, for example, and the computer adaptive testing, which are at the core of both the patient reported outcome measurement information system, and also they are defined in the NIH toolbox. And these systems have been found to be very relevant across conditions that were developed and evaluated using state-of-the-science psychometric methods. So NIH definitely put a very comprehensive and a very encompassing toolkit together. And once we have this toolkit, what are the next steps? We need to know, we need to understand as a clinician how these resources are available, how this toolkit is available to us. And so, what are the take home messages that I'm trying to emphasize with the help of this toolkit that really was very interesting to understand? And the paper was a very interesting paper. The paper envisions and it points out something poignant. It says the time is right to bring together music therapy and music medicine and neuroscience in new and synergistic ways. There are exciting tools, new tools for monitoring the brain in action are being developed. And through the Sound Health Initiative, the NIH is supporting research to pinpoint how music therapy and other music-based interventions work. The second point this paper tries to stress is that there is preliminary evidence of beneficial effects of music-based interventions and is mostly limited to the anecdotal evidence or small-scale clinical trials, creating a stumbling block in practical advancement of developing and testing interventions that can be low cost, mostly devoid of side effects, scalable in healthcare systems, and generally well accepted by patients. The third point that they try to make in this paper is, as we all have chanced upon or we have understood talking about this technological advances and framework, is that the NIH is definitely committed to developing standards and tools that can be applied for music-based intervention studies. And in order to achieve this goal, it is important that we take input from interdisciplinary expert panels composed of neuroscientists, music therapy and music medicine professionals, behavioral intervention researchers, and clinical trial methodologists, and patient advocacy and arts-based organization representatives to create a toolkit for research on music and health across the lifespan. And so it's not a bicompartmentalized toolkit, music-based intervention. It requires an amalgamation of different professionals coming together that control the remediation aspects or intervention aspects of Alzheimer's disease patients. Next, this toolkits suggests that it provides investigators with broad guidelines and recommendations on a consolidated set of common data elements for music-based intervention protocols and a core data set for functional outcome measures and biomarkers that can be used in specific studies. In this particular paper, they only focused on brain disorders of aging as a model system, and it dips into Alzheimer's and dementia. And so I took up this paper because of that particular reason. And lastly, this paper mentions that it's critical that music-based intervention investigators align their specific studies to rigor and reproducibility policy. Moreover, the NIH strongly suggested in this paper that investigators in the US, for example, submitting studies for NIH funding should consider this toolkit in order to put digital measurements of facial expressions and movement, for example, as a innovative personalized music delivery systems that would enhance the ecologic validity of MBI protocols. So, as I understand, so much of research has gone through this by different agencies of the NIH. For example, the people involved in this paper were extensive. National Center for Complementary and Integrative Health, National Institute of Health Sciences, National Institute of Aging, National Institute of Health, National Institute of Neurological Disorders and Stroke, National Institute of Neurological Disorders and Stroke for Complementary and Integrative Health, National Institute on Deafness and Other Communication Disorders, Office of Behavior and Social Science Research, and National Institutes. So all these agencies came together and put this toolkit together. And having read the paper in depth, the one point that strikes to me is with the OpenAI and with AI technology that we currently have, I'm sure this paper was published in 2023. But by the time clinicians are designing more protocols and more frameworks, they are going to realize that they have a lot of technological advances within 2023 to 2024, where they can dive deep into AI technology and also use different pieces of music or generate new pieces of music specifically designed to individual patients. That could be another way of looking at it. And so this toolkit foresees potential research opportunities for future modification, of course, and for updating the toolkit relevant to various diseases and conditions across the lifespan, as I mentioned. So there is exciting opportunities and avenues for clinicians to design different studies and music-based interventions. We have great horizons to look forward to in order to develop this platform globally and then make sure that we can bring down the staggering number of Alzheimer's disease prevalence by 2050 as projected by the World Health Organization. It has been such a pleasure to talk about this toolkit and how this toolkit helps to improve the rigor and replicability of music-based interventions. And there is so much more to do, and there is so less time to do. And as a researcher, and I'm sure other clinicians who are a part of this conference or listeners who are in the medical community or otherwise a part of the community who have people who are suffering, who know people who are suffering from Alzheimer's disease or dementia, will have a optimistic view of the technological advances of intervention that are coming through. And so the essential sum and substance of this presentation is that there are toolkits. We have a lot of hope, and there is much that needs to be done as a researcher. And so I'm hoping that moving forward in the next 5 years, the incidence of dementia or memory loss, cognitive, behavioral, psychometric, and motor functions are all, improved very well with music-based interventions. And I'm looking forward to those great times, scientifically speaking. It was absolute pleasure talking about music-based interventions and its future and how the National Institute of Health, especially in the US, is doing comprehensive research and putting together enough data for researchers to dip into and be designing their protocols from. I would like to thank Chitraji for giving me this wonderful opportunity as a scientist to present the little bit of knowledge that I have gained researching for this conference. Year after year, I've only enriched my scientific knowledge, and it has given me more impetus to come back and attend to this World Music Conference that pivots around the theme of music and different medical indications, and how music therapy helps alleviate these indications. Most of us do not understand the value of music, and how music indirectly, without our knowledge, develops our brain and brings peace and harmony into our hearts. And so I would like to sign off by saying that let music be the DNA of our lives. And no matter which medical indication or no matter which stages of our life, hold on to faith and hold on to music. And I think as scientists, enough research and empirical evidence has already been presented that music changes the DNA of our life. And so happy listening, and thank you very much for your patient audition. And I would like to thank everyone who attended this conference, and I'm excited. Hopefully, I get another opportunity to present my thoughts next year as well for the 9th World Music Conference. Thank you and have a great day.
Hi everyone, I'm Brian Jantz, Associate Professor of Music Therapy at Berklee College of Music in Boston, Massachusetts. I'm really honored to participate in the World Music Conference as a patron and panelist this year. For the panel on the role of caregivers and family, I'm really excited to share based on my own experience and to listen and learn from the other panelists here today. Appreciative and very excited to be here. Thanks again for having me. How can caregivers identify the type of music that resonates best with the individual needs of Alzheimer's patients? This is a great question. I think whenever possible, gathering as much information from family that can be really, really helpful, or close friends. Obviously, depending on the stage of Alzheimer's, directly from the patient as well. And I think combining our own observations during live music or while a patient is listening, and an assessment of how patients respond to specific genres, specific tempos, all the elements of music, with this additional information really gives us context, and any of that info we can gather related to past meaningful music experiences can be a really good approach. And this is true in other music therapy settings as well. And I think it's a real priority if patients are challenged to communicate preferences, and to communicate what their past experiences have been with music in a more direct way. What are some common misconceptions about music therapy that caregivers should be aware of? Another good thought, another good question. While music is certainly a universal phenomenon, it's not necessarily truly a universal language. This is something we discuss in class a lot, even in Intro to Music Therapy. You know, I put the question out there to the class: is music a universal language? But when you really think about it, the cultural and personal differences and how individual patients respond and relate to music. Minor in one culture could be celebration, commonly used for celebration, and somewhere else might be more connected to music that is melancholy or expressing something that's reflecting more of a low mood or something more difficult. So getting to know not only the cultural background, but then the associations and the individual responses is really important. And we allow for these differences, and we aim to not make assumptions in a way that would limit the type of music offered or the method that we might be using. So when I say method, methods that music therapists often use can be either receptive, so receptive listening, which can be more active, or more passive, depending on who you're working with and where they are that day. It can be recreative. That's recreating familiar songs, so existing songs, but a live recreation of those songs. Could be compositional. So that also can be, taking an existing song and adapting it and changing it. There's kind of an between recreative, compositional. But it could also be composing something original, either with the patient or with the family, with the caregiver in this case. Or it could involve improvisation. I think some caregivers or family members, clinical team members, and even some music therapists in the past, maybe even now, might assume music experiences with this population should really focus primarily on music from when the patient was between 18 and 26 years old. That used to be kind of the go-to, the way we viewed working with Alzheimer's would get the most response, and using mostly receptive and recreative methods. So favorite songs, either listening to them or, sing along kind of style. Listening to pre-recorded music or live music making with these familiar songs. And this is sometimes true. This can definitely be part of a plan, part of a session plan. But planning for sessions or specific music experiences should really occur after assessing all possible ways a patient might benefit from music. So really being more in like discovery mode, kind of thinking through all the different tools that we have, all the possibilities, all the music that exists is a possibility. While our starting point might be music from those early adult years, you could work with an individual that actually really connects with more contemporary, more recent music, or music from their early childhood. So allowing for that. And we often plan sessions in a way that incorporates a variety of music therapy methods, kind of a, plan, this is plan A, this is plan B, C, D, and allows for flexibility based on how the patient is responding on that day. So even if a patient tends to respond primarily to music from, the 40s, 50s, 60s, and tends to enjoy listening, maybe singing along, there could be a day when they're more open to improvising, or they're more open to kind of collaborating on writing a song. So really allowing for that, I think, is important and not always as obvious. Can you share specific examples or techniques of integrating music into a daily routine for Alzheimer's patients? Well, I really think offering therapeutic music listening experiences throughout the day can be extremely valuable. Depending on the individual patient, the stage of Alzheimer's, the music could be selected based on the caregiver's perceptions of what might be most supportive. The patient could be given choices, often, should be given choices, or the patient could independently choose music listening experiences from pre-selected playlists, perhaps curated in consultation with a music therapist or another member of the team. These playlists are created with intention, taking individual preferences and associations into account, as well as musical elements such as tempo, dynamics, volume, harmonic structure, and of course the genre and preferred genre and cultural themes. We often utilize a music therapy technique we refer to as the ISO principle. Is basically meeting someone where they currently are in a way, and then shifting gradually over time. So this can work well for agitated states, using music that initially reflects this, not necessarily amplifying it or going beyond it, but kind of meets that state where it is musically, and then shifts to music maybe aimed at a relaxation response. And it can be a gradual shift. Also with individuals in more of a low mood or a depressed state, offering playlists that meet that energy, and then gradually shift to music that perhaps is more upbeat. So you're kind of gradually encouraging the patient to shift in a different direction. And without this focus on the ISO principle, we can sometimes experience a disconnect, or the patients can sometimes experience a disconnect, and we'll see that, and maybe a lack of response or a lack of attention. And research, there has been some research specifically on ISO principles showing that when the music, live music or receptive music is more intentional in terms of meeting someone where they are, as just as a place to start. It really builds the trust and perhaps helps the patient feel a little more understood, a bit more heard in some way. What impact have you observed on the caregiver-patient relationship when music therapy is introduced? This is a great question. I think about many different settings where I've had that opportunity, and how it typically is a really, really good thing. So whether it involves a caregiver who is a clinical team member, or if we think of family member, the possibility that family member is the caregiver in a way, it can definitely positively affect the dynamic. It can enhance the support provided in a few different ways. I think the music is still benefiting the patient directly, but we also have this ripple effect as the caregiver perhaps is personally benefiting from the way music is changing the environment, transforming the environment. Maybe they're more capable, more resilient in providing patient care and support. We know there's a lot of burnout, a lot of compassion fatigue. So I think when we bring music into the equation, it can really shift. It kind of changes the context under which the care is being provided. Caregiver also learns about aspects of who the patient is that they might not have been aware of. It could encourage a more holistic view of this patient rather than viewing that individual as their illness. Although music therapy in some settings does target really specific goal areas, we document specific measurable objectives. Because this tool we use, music, a really relational art form, there's always a general focus on providing an experience that promotes a trusting relationship and really honors the humanity of all involved. How do caregivers adapt when Alzheimer's patients show varying levels of responsiveness to music over time? This is a great question. This really, for me, speaks to the process of treatment planning, the process of implementation, the process of documenting, the process of deciding what goals you're focusing on. It all changes and shifts over time. I think it's very important that we allow for that. So this might depend on their access to consultants, such as music therapists or other team members serving in that capacity, who have that insight, that experience. I think ideally there would be consistent communication just regarding how patients are responding, so that adjustments can be made as needed throughout the progression of the disease. If access is more limited, it could work well to have a treatment plan that is created initially that allows for more flexibility. So it is not just based on optimal responsiveness or limitations even, or it's not just based on one specific method all of the time. Giving the caregiver some options, I think, is a really good way to maximize potential benefits. What resources or training programs are available to caregivers to better understand and implement music therapy? This is an important topic, and I think there's been a lot of growth in this area. I think music therapy being less separate, I would hope, from from community musicians, from other allied professionals that are interested in music and are interested in the power of music through the lens of neuroscience, through other ways of looking at how music can impact our lives, how it does impact our lives, and better understanding that. If I use the program at Berklee College of Music as an example, I'm seeing this shift toward offering more resources for community musicians, for caregivers, for families, other clinical team members who are not music therapists. We're now offering events and opportunities for collaboration through our Music and Health Institute, and that's separate from the music therapy program, related, connected, but separate. And this is multidisciplinary. And the idea is that we create, better solutions through collaboration than through the lens of only one discipline. Our music therapy chair, Dr. Joy Allen, also is the director of the Institute and has really been a visionary and a leader in this area on a global level. We now offer a new community health musician certificate that is open to everyone. I'm really hopeful that this does become a trend. Maybe it already is, and that there's less gatekeeping. None of us, own music. There is potential for everyone to utilize the power of music to really support their community, their family, their patients, in different ways, in different settings. So resources to access direct services. So I'm speaking about direct music therapy services, but also information on considerations when someone's aiming to incorporate therapeutic aspects of music really should be accessible to all. I would encourage you to, feel free to explore the Music and Health Institute website, Berkeley Music and Health Institute website. There are a lot of good resources there and offerings. It's a database on research, related research. And I've seen so much growth since 2018, and it's clearly like a new direction for our program. And I think a new way of working together and collaborating. And I think it really, in a way, connects with the mission of this conference here. How can family members who are not primary caregivers actively contribute to music therapy efforts? So there is a wide range of ways family members can utilize music, and we see this all the time, to really support their loved one. And some will be doing this, instinctively. I think there are many we meet who are already doing a lot of these things. So then just looking to encourage it, support it, maybe give a few new ideas. But others, it might not be, they might not have that intuitive sense that music is a really go-to supportive tool for their family members. So whether they're at home or from a distance, I know personally it's very difficult when you're far away from your loved one and they're going through this. But projects like, one example I can give is a life review project. I'll say a little more about that, but something like that that's concrete and also process oriented, I think can be really meaningful and can involve the patient, other family members, as appropriate. So this is process oriented. It's really revisiting the people, the places, the events of the patient's life, and then considering the musical associations. What would the song be for this period of time or for this place where we lived? Was there a song that we really connect with that, or that we know that the patient connects with that time? And this could lead to a legacy project that families can really get involved with, get creative with, and it could range from a 10-song playlist that kind of tells the story of this person in song, or it could even be a multimedia project that incorporates video, music, photos, artwork. This could be done in one day. It could go on for weeks. Could come back to it over time. It could really be ongoing, and maybe you start it when the patient is still able to actively contribute and make choices on what to include. But it could continue indefinitely. Could be revisited with the patient as a way of maintaining that connection with family, even potentially during a patient's decline. And I think it can serve as comfort. I've seen where it can be a comfort after the patient has passed and the family is grieving, to have that legacy project to go back to. It also kind of contains that in a way where you can choose when you want to go back and experience that, and you could even add to it after. It could be an ongoing, family legacy project. And family members can also create less formal playlists, of course. It doesn't have to be a life review project or be structured in that way. And if they are, musically skilled, I would definitely suggest recording videos. I saw that so often. I did that myself, during COVID, as a way of helping someone feel a bit less isolated. And I think putting some thought behind what you're sharing. So like meaningful songs, meaningful music, that caregivers, that family can give the patient access to. And I would just add, if visiting on Zoom or FaceTime or some other way of visiting remotely with the patient, maybe offering to listen to a song together as part of the visit, or even to play a song live for the patient remotely. That'd be something that really benefits all involved. What innovations or advancements in music therapy do you see benefiting caregivers in the near future? So this question really leads me, or the last question really leads me to this next question in a way, this consideration. So with new technologies, I think there will be more potential than ever in the future, and I think there already is. It's already happening, to have access to our loved ones' listening history on streaming platforms. I'm thinking about, Spotify, for example. I think all the streaming platforms are doing this now, what you've listened to most, kind of reminding you of that, or your on repeat playlist. It's always, for better or worse, it's always kind of tracking what we're doing. So how to make use of that, to maybe eliminate some of the guesswork about, what does our loved one enjoy? So if there's, there could be a way to have access to that, to share that. That's a really simple way to have it documented. What is the preferred music band that they're continuing to listen to? We had a MIT hackathon a few years ago at Berkeley. So this was multidisciplinary teams focused on specific challenges in our world that they wanted to address with music. Some were music therapists, most were really not. So they were from all different backgrounds, different professions, different areas of study. And two of the teams that really I'm often reminded about, I often think about, it really connects with this. So one focused on the potential for wearables, informing how we facilitate music therapy sessions live in real time, but also music listening, so that we could, potentially combine data that's always being collected from a wearable, and that could be, a Fitbit, an Apple Watch, Google Watch, Aura Ring, and then, combine the data collected that's always being collected from this wearable with our perceptions of how patients are responding to a music experience. So kind of looking for those correlations. And I think there's potential for this to benefit patients, so that even just, more passive receptive music listening could adjust in real time based on how the patient is responding on any given day, any given hour. I have been working on projects like this for a while. I know many others are as well, but it could be a way that the music is adjusting on its own based on how a patient is responding to the music they're listening to. Of course, it doesn't tell the whole story, and that's why we need the other more qualitative observations as well. I think virtual instruments and the dramatic improvement with audio quality that we have now when connecting remotely is really providing us with more opportunities than ever to support patients and reduce isolation, even from a great distance, and even when we are not able to share the same physical space.
Good morning, everyone. Today I will be discussing the role of music in the treatment and management of Alzheimer's disease. We will explore how music therapy can serve as a powerful complementary approach in improving the quality of life for those affected by this condition. I am Dr. Jiten Kumar Sinha, and I am honored to share this insightful topic with you. Let's start with an overview of Alzheimer's disease. So, Alzheimer's is a progressive neurodegenerative disorder that worsens over time, affecting memory, cognition, and independence. The symptoms progress through these stages: early, middle, and late. The pathology includes the formation of amyloid plaques and neurofibrillary tangles in the brain. This disorder profoundly impacts not only the patients but also their caregivers, requiring full-time care in advanced stages. So, music therapy is a clinical evidence based practice that uses music intervention to achieve therapeutic outcomes. It is administered by trained professionals who design these interventions based on individual patient needs. The goals of music therapy include enhancing cognitive function, then improving emotional well-being, promoting physical rehabilitation, facilitating the social engagement, and improving overall quality of life. It offers a non-invasive and holistic way to address the multifaceted challenges of Alzheimer's. The therapeutic goals of music therapy are diverse. For cognition, it stimulates memory and slows cognitive decline. Emotionally, it enhances mood, reduces stress, and fosters emotional expression. Physically, it aids in coordination, mobility, and maintaining motor skills. Socially, it encourages interaction and communication. But most importantly, it significantly improves quality of life by creating enjoyment and stability while fostering independence. So, music and the brain, if we talk about it, music activates multiple regions of the brain, including the hippocampus for memory, the amygdala for emotional processing, the prefrontal cortex for decision making, and the motor cortex for movement. Music can bypass the damaged neural pathways, enhancing brain plasticity and reducing stress through dopamine release. These processes highlight why music is such a powerful tool for those with Alzheimer's. Now we will talk about memory stimulation through music. Music therapy can trigger long-term memories and emotional connections, often serving as a cue for memory recall. Interestingly, consistent responses to familiar music are even seen in advanced stages of Alzheimer's. Episodic memory improvements have been observed, making music an effective stimulus for cognitive and emotional engagement. Now we should talk about emotional and behavioral benefits. So, music therapy offers significant emotional and behavioral benefits. It enhances mood, reduces agitation and aggression, and facilitates emotional expression. Additionally, it provides stress relief and promotes relaxation, contributing to better sleep patterns. These outcomes are dramatically improve the emotional well-being of patients. Okay, so let's talk about the cognitive and social benefits. So cognitively, music stimulates attention, focus, and memory recall while enhancing the flexibility and problem solving. It also promotes brain plasticity and cognitive engagement through structured rhythms. We talk about socially, it fosters interaction and communication, helping build relationships and reducing feelings of isolation. Now let's talk about managing the challenging behaviors. So music therapy helps manage challenging behaviors too, often associated with Alzheimer's. It calms aggression and agitation. It is known to improve focus and reduces wandering. It also facilitates routine activities and communication while decreasing symptoms of sundowning. These effects are invaluable for caregivers managing the daily challenges. Now let's talk about the integration into Alzheimer's care. Integration of music therapy into Alzheimer's care is highly effective. This includes creating personalized music playlists, scheduling routine based music sessions, and organizing group therapy for social interaction. Caregiver involvement and training further enhance its impact. Used along with medication and behavioral interventions, music therapy leads to significant long-term quality of life improvements. Okay, so now we will talk about the key takeaways in today's presentation. So to conclude, music therapy improves social interaction, emotional well-being, and cognitive stimulation. It helps manage behaviors, enhance daily routines, and provides positive outcomes for caregivers. As a holistic and personalized intervention, it is an integral part of comprehensive care plans for Alzheimer's patients. So, thank you for your attention. Music therapy represents hope and progress in the care of Alzheimer's patients, and its integration into treatment plans can make a profound difference. I'm happy to answer any questions you might have. Thank you.
Namaste and greetings to everyone at this 8th World Music Conference. I'm Sanak Kumaratreya, a music therapist based out of Bangalore, and I will be presenting today about training nurses in handy music therapy techniques that would be useful in achieving patient compliance from persons with Alzheimer's disease. We all know Alzheimer's is a debilitating disease. It can have effects not only in cognitive realms, but also in social interactions, in the overall quality of life of the patient and the caregivers, the family, and most importantly, even the nurses. In Alzheimer's, the medical condition on one side offers loss of memory, loss of cognitive skills, thinking and analytical abilities. On the other side, it is also extremely filled with anxiety, resistance to commands, instructions, which makes it very difficult for nurses to help the patients overcome that condition and lead a better quality of life irrespective of the prognosis. This strange condition also leads to a slight problem within the nurses as they are not able to achieve the sort of compliance from the patients. It results in a rather depressive condition for the nurses. And the nurses experience a lot of stress, anxiety, and fear, and sometimes even guilt for not having been able to take good care of their patients. But most of the support comes from non-pharmacological approaches, holistic care, which is the fulcrum of care for Alzheimer's condition. Now, many of these non-pharmacological approaches also are not motivating enough for our patient friends. What happens with them is there is an layer of an obsessive defiance that sets in, with the advancement of age and the disease. To overcome that, we luckily have some techniques in music therapy. Now, we all know that music is a very pleasurable activity. So, whether it be listening to music or performing music or songwriting or any involvement in music is a pleasurable activity. Now, this can be used both by the nurses to affect their own mental health and equally impart a therapeutic benefit to the patients. So, for the benefit of the nurses, let me take you through a few of these powerful music therapy techniques that can help the nurses cooperate with the patients. Now, one of the popular technique is called gestural lyrical musical routine charts. Now, it's commonly used among children, but even among elderly and geriatric care, we can use this technique quite effectively. This technique involves basic gesture, a lyrical line that connects with the need of the patient, and the musical phrase that would rely more on tonality rather than pitch and rhythm. For example, my patient tends to forget that he has to brush his teeth by morning, so we create a small song here. 7 a.m. brush your teeth, and 7 a.m. brush your teeth, and 7 a.m. brush your teeth, and 7 a.m. brush your teeth. As simple as that. Now, there is a significant difference in dealing with children vis-a-vis dealing with our geriatric population. Now, what happens is many of our Alzheimer's patients are aware that they are elderly people. So the way we deal with children is not the way we can deal with them. 7 a.m. brush your teeth can be the song, but we don't teach it to them. Now, if it were children, we can just teach them the song, and then we can expect that we can connect with them and get them to follow the routine. Whereas that would not work with our elderly patients. Instead, what we do is we make a small recording of this song, play it in the background, and ask them to teach us the song. That way, they get an air of superiority that they're doing something age appropriate, and thereby they also tend to remember it over time. And when they are refusing to perform the activity of brushing their teeth by morning, we can help them recollect by singing the song for them and help them coordinate with the daily activities. We can add on, depending on the routine, we can add on various phrases, but we ensure that we don't sort of give them all the phrases at one go. It's generally one phrase at a time, because they would not be able to grasp all the lines at the same time. The second technique I would like to present is called Konokol cognitive stimulation. Now, we all know that cognitive stimulation is one of the strong therapies that are used for Alzheimer's patients. In Konokol, we have a world of opportunities to create many games and many activities based on Konokol and cognitive improvement. And many of these exercises are pretty simple. For example, tha, dhi, thom, nam. Tha, dhi, thom, nam. This tadi tom nam structure is a balapatam or the basic lessons of anybody who learns mridangam. Now, this can be effectively used for our Alzheimer's patients as a cognitive stimulation. First, they tend to practice Tadhi Tomna, another new exercise. So they are generally motivated. And as we conduct it as group therapy sessions, it's all the more interesting. And when they follow up on this Ta Dhi Tom Nam sequence, they tend to get excited about it, and we can conduct it in multiple ways. The first way is just getting them to repeat. The second is taking turns in a group. The third is giving a metronome support and getting them to say at exact intervals. Now, there is a higher order cognitive exercise in this, wherein we start telling this faster and faster and faster, and then slowing it down, and then repeating it at a faster pace, and then slowing it down. Now, this sort of an exercise really gives a cognitive boost to our patients. In fact, in our experience, we have seen some of our patient friends have sort of forgotten my name whenever I have gone for the therapy session, but they remember that this is the Tadi Tomnam guy. Okay, that's great because we are helping them by giving some sort of a peg to remember people. So this would really help our nurses to engage with our Alzheimer's patients. The third technique I would like to present is movement integrated rhythmic cueing. Now, rhythmic cueing is very popular in speech therapy. Alzheimer's patients also often require speech therapy. But here our concentration can be on their response. Tala exercise is movement integration. So the same Tadi Tom Nam can be formulated as Ta, Di, Tom, Nam. Should they find it difficult? Ta, Dhi, Tom, Nam. Initially, when they are trying with these exercises, they might find it a little challenging. But over a period of time, when they get the Ta, Dhi, Tom, Nam, we can then tweak it up with other movements. Movement of the right hand and the left hand, and then the head movements, and then the shoulder movements, and we can stage by stage we can improve on the movements, whereby there is a correlation between the movement and the syllabalization, which also helps in an integrated approach to cognitive stimulation. We have seen many of our patient friends excitedly look forward to these sessions and remember what they did in the previous session. Although they are in quite advanced stage of Alzheimer's, although many other aspects of their memory is failing, somehow musical inputs seem to remain. There are many ways in which nurses can utilize these techniques and help our patients better. These exercises generally don't require a lot of coaxing, and hence the nurses will not have a trouble getting compliance from the patient. I hope these techniques help our nursing friends to help our Alzheimer's patients better. Thank you all.
Good evening, friends. As we bring the 8th World Music Conference to a successful close, I am honored to deliver the vote of thanks. We are immensely grateful to our distinguished speakers, panelists, and experts who illuminated the vital role of music in Alzheimer's prevention and care. Your shared knowledge has truly enriched the platform and inspired us all. A special thanks to Councillor Ken Wood, Lord Mayor of Birmingham and patron of the British Carnatic Choir, for his enduring support of our initiatives. We are equally grateful to Dr. Derek Anderson, CBE, His Majesty's Lord Lieutenant of the West Midlands, for his encouraging message and steadfast support. Our heartfelt appreciation also goes to Mr. Richard Parker, Combined Mayor of the West Midlands, whose endorsement adds immense value to our mission. Our deepest appreciation goes to our Chief Patron, His Excellency Dr. M. Venkatachalam, IFS, Consul General of India in Birmingham, for his unwavering support and encouragement. My heartfelt gratitude to my mentor, Dr. Paul Sabapatiji, CBO CBE, for his encouragement and guidance. We are also delighted to have received the patronage and endorsement of the United Kingdom Commission for the UNESCO. Our heartfelt thanks go to UNESCO UK for their invaluable recognition, and to our esteemed wellness partner, the British Association of Physicians of Indian Origin, BAPIO, for their generous support in advancing this mission. To our global attendees, your encouragement is the heart of this event. And to the organizing team, your dedication behind the scenes has been remarkable. Together, let's continue to explore the transformative power of music in fostering wellness and healing. Thank you all, and we look forward to welcoming you again next year. Stay well, stay safe, and stay positive.